Thank you, and welcome to this episode of Inside the Expert's Mind, which is when I get a chance to interview some very interesting and key players in the field of medicine, surgery, and other fields. And I'm delighted today to have with me Professor Tracy Hull, who's extremely well-known colorectal surgeon and works at Cleveland Clinic in Ohio. If I can have my first slide, please. Just to say that I've now worked with the Cleveland Clinic in London for just over 3 years, and it's a real pleasure to work for this organisation. And they truly adhere to their values and goals, as shown in this slide here. And I always like to bring to everyone's attention that the guiding principle is that we treat patients and fellow caregivers as if they were family, and the Cleveland Clinic as if it was our home. And we really adhere to the values of quality and safety, teamwork, empathy, inclusion, integrity, and innovation. If we can go back to the first slide, please. So Tracy, tell us a bit about where you were brought up and your early years.
So I was born when my dad was in veterinary medicine school at Ohio State University, and he and my mom moved back to their hometown, which was Fremont, Ohio, which is northwestern Ohio. And initially, we were extremely poor. It was the early 60s, and my dad had his practice in our garage. And at night, he would do surgery on our kitchen table till like 1963, so for the first 3 years of my life. And so I grew up working in my dad's office, helping him in surgery. When I was very little, he would do surgery, as I said, at night on the kitchen table. He would be at one end of our small kitchen table, and my sister and I would be eating at the other end. So it was just a pretty routine thing. My uncle is a medical internist who settled back in Fremont, and I guess by the time I got to college, I decided that I had a lot of veterinary experience. I had done a lot of stuff with horses at Ohio State, taking them down there and watching them have surgery, etc. And then that I wanted to go into human medicine. So that's why I chose that.
But why human and not veterinary? In the UK, to become a vet is infinitely more difficult than to become a human doctor. I must admit, I never thought about becoming a vet. With all that experience you had, what made you wish to go into humans and not continue the family line?
I don't know. I don't know if it's a family line. My grandpa was a lawyer, so that was not in the field of medicine at all. I don't really know. I didn't even really entertain becoming a veterinarian. Not that I didn't like it. We were just flooded with it. You know, before we went to school in the morning, we did chores. Our holidays were continually interrupted with people bringing animals hit by cars that had to have broken bones set and things like that. I can remember my mom always had Thanksgiving at our house growing up, always. And it used to be a joke year upon year that we would be out in our office, because eventually we built a very nice office that was on our property. It was, you could throw a stone and hit it from our back door. And we would be out there taking care of animals, doing x-rays, setting their legs, etc., while the rest of the extended family was in the house having American Thanksgiving dinner with turkey, etc. My mom was cooking. So I don't know if that changed my thoughts about it. It's hard to say, but I had a lot of it. I had a lot of it growing up, that's for sure.
And do you think that dealing with animal owners was easier than it is to deal with our difficult patients? Did that give you a good grounding in how to manage expectations and people?
Maybe. My mom was the person who was the people person that dealt with all the things that were problems, and I think I really learned how to deal with people through her. My dad I have a lot of my dad's traits. He was pretty grumpy, pretty gruff, pretty straightforward. And, you know, he didn't candy coat anything. And then he would tell people stuff, and my mom would smooth it over, actually. So I think that I learned a lot from both of them. but she really taught me like how to answer the phone and how to talk to people on the phone. That's a skill that goes right back to her. And when my dad, like when I can remember when they would bring dogs in that we had taken care of their whole life and it was time for them to be euthanized, you know, my dad would cry. He was really, he just could hardly do it. And a lot of times my mom and I had to euthanize him because he just couldn't do it because he was so sad. So, you know, all those types of things and dealing with that type of grief and stuff, I think I learned a lot of that with my parents.
Okay, I can imagine. And tell me, in terms of technical aspects of what you did in your early years, do you think, two questions really, do you think that really helped you with your technical abilities, which are obviously well known as a surgeon? And is there something in particular that you brought with you from that experience with the veterinary world into the human world?
Probably there's three things that really helped me with my technical abilities. One was the surgery, and my dad was, you know, when you're in private practice, I think you are much more finicky about like how much suture you use, etc. And I mean, we would tie down to the very end of the suture, and I still do that. So I think that was a something that I took from him. I also took, he was really finicky technically. And I remember, you know, thinking about that, and I think I am very finicky technically. Um, I took piano lessons for 10 years. I cannot play a lick, but I think that really helped some of my coordination. And I love piano lessons. The teacher would say to my mom, "Mrs. Hall, you're wasting your money. She doesn't practice. She doesn't do this." My mom would say, "Oh, she practices a lot. She just isn't any good." I wasn't any good. And then the other thing that really helped, I think, my technical skills was my mom actually thought I should be a secretary. And I took typing in high school, and not just typing. I mean, she made me take it so I could be a secretary that she thought I should be. And so I could really type very efficiently right out of the get-go when I went to college. And that, I think that really helped my eye-hand coordination. A funny story about that. So when I was a surgery resident, my third year in Syracuse, New York, on Christmas Day, we were just talking about this on Christmas. Everybody, my husband and everybody was at my parents' house, and they were having Christmas, and I felt bad, and I was on every other night, and I was really feeling sorry for myself, and I called home, and my mom gets on the phone and says, "Well, I told you should have been a secretary. You'd be home right now if you were a secretary." I was like, "Oh, that doesn't make me feel any better."
That's not great. So tell me, my understanding of American medical school is that people get into huge debt because it's so expensive to go through it. The UK now, in my day, it was all paid for by the state, but now we have to make reasonable contribution to our children's university education. Did you do anything in particular to get your way through medical school and help pay off those debts?
So I was extremely, extremely lucky. I did some different jobs. Um, One thing that I was really lucky about was I was very successful competing with horses, and I would buy horses pretty inexpensively that had attitude problems or behavior problems, and be able to compete successfully with them, and then sell them after I showed them for a profit. So I made some money that way. I worked in my dad's office, and then he didn't have to hire somebody, so I made money that way. And then I had a little bit more flexibility in my hours sometimes, so I could compete with horses. And you know, I was just really lucky. I got out of medical, and I lived very cheaply. I mean, really, really cheaply. And I graduated from medical school and had essentially no debt. So I was extremely lucky. I know today in America, young people have over $200,000 worth of debt, American dollars. And, you know, I just don't see how they're ever going to get out from under that with interest and everything. So like I said, I was very frugal and lived very cheaply. I mean, some of the way I lived really cheaply. And I, really worked and saved my money and tried to do things. Even during medical school, I tried to do little jobs so I could earn money. Every little bit helped.
That's it's extraordinary. So Tracy, tell me, why did you go into colorectal surgery? I always joke that there's an English expression which is where there's muck, there's brass, which is what I tell people. It's a good way to make it, or it's a way to make a living. What made you pick colorectal as opposed to any of the other specialties available to you at the time?
Yeah, that's an interesting story. So the thing I say to patients when they ask me that, because usually they say it with a little disdain, I'll say, well, aren't you glad somebody wants to go into that?
Yeah, good answer.
So I thought I wanted to be a plastic surgeon. I have one sister, she's mentally challenged, and she has some physical debility, and I think that probably influenced me. And all throughout medical school, that's what I thought I wanted to do, was be a plastic surgeon. And when I went to Syracuse, New York, still thinking I wanted to be a plastic surgeon and was kind of on track for that, the plastic surgeons were not happy people at all. In fact, they were pretty miserable. And that kind of turned me off. So I thought, well, I'll be a general surgeon and I'll go back to, I was married then, I'll go back to my hometown and practice in the hospital where my uncle practices. And I mean, I know I could be happy doing that. And actually not about. So at the end of my 4th year, beginning of my 5th year, one of my very good friends who is also a fellow, other resident in the program, Chris Murph, said, I'm going to do colorectal surgery. You should think about it. You would really like it. And you will be able to really use that skill if you go into general surgery. And I thought, oh, that's really probably true. And so I was very late to enter the match, the U.S. match for colorectal, extremely late. I got into the Cleveland Clinic purely by accident. I was like their 15th or 16th choice in the match, which is kind of unheard of. And a lot of accidents played together. The other thing, the group in Syracuse, the colorectal group, that was led by Dr. Jack Nicholson, who is still there, and David Halloran, they were very, very positive. They really taught technical surgery, which I liked. I mean, I knew the TME plane from them. I didn't know what it was called, but I knew what it was because they were technically very, very good and very well trained. And I liked that aspect of things. The hemorrhoidectomies they did, I still do like they did because they were like works of art. So that all combined together to thrust me into colorectal surgery.
Well, thank the Lord for that, as it were, that you managed to find your way in. But I suppose other specialties would have benefited from your expertise had you chosen them as well, I'm sure. So going along that vein, tell me, over the last years that you've been in colorectal surgery, what would you say is the greatest advance in colorectal surgery in your, and I'm of a similar age, our time?
Better chemotherapy for colorectal cancer. So in the 90s, I used to always think when we would have our makeshift tumor boards, this 5FU stuff we're given, it doesn't do any good. If we don't do good surgery, these patients are in trouble. And as you know, the Europeans, they were the leaders in improving our colorectal chemotherapy. We had radiation therapy, and we used that not as advantageously in the United States, but I really think that chemotherapy. So at the Cleveland Clinic, we were already doing good rectal cancer dissection. I mean, Dr. Turnbull had figured that out way before Professor Heald made that, so well known. So to me, that wasn't our greatest accomplishment. I think figuring out this chemotherapy business, I think that was really a big accomplishment. The technical things like laparoscopy and robot, yeah, those are okay, but we were doing okay with open surgery. We weren't doing okay curing patients from cancer and prolonging life. So I think that's a huge thing that's really changed over my 30-year career.
Yeah, I'd be very inclined to agree that with you on that. Um, so tell me in terms of the future, what would you predict as being, aside from other, I suppose, immunotherapy, magic bullet cancer therapy, do you think there'll be any great changes in should we say technical aspects of colorectal surgery over the next couple of decades? What would you predict?
I think the robot's going to get better. The robot right now reminds me of laparoscopic surgery in the early 2000s. I don't do robot, but I get to hear all the people talk about some of the frustrations of it. I think it's improving, but I think it will continue to improve and be a better tool to use. We're still going to need open surgery because patients are still going to leak. They're still going to have problems. And I think that we'll probably have fellowships to teach people to do open surgery, because I think that will be a skill that will be
Yeah,
lost very quickly. I think that we are going to have better medicine that's individualized. We'll be able to figure out from genes and stem cells how to diagnose and then treat more effectively patients' problems. I think we're just at the very beginning of those stages of really individualizing care. And I think those will really make big advantages. You know, as far as surgery goes, we're still gonna, I don't think we're gonna cure all the ills. I would be surprised that require surgery. I can't imagine, unless something miraculously happens, that diverticulitis isn't going to be around in 30 years. Inflammatory bowel disease may not, so that may be something that we are able to get a better handle on. And I still unfortunately think there'll be some cancers we'll have to operate on. So I think we'll still have to have good technical skills. And we may come up with diseases we don't even know about that we have to take care of. Who knows what's going to happen with, you know, the after effects of COVID and things like other diseases that may come down the pike.
and tell me, so what advice would you give to an up and coming young person who aspires to be a colorectal surgeon? What would you advise them?
Well, at least I don't know about in other parts of the world, but to get into a program in the United States, it is so competitive. 50 some people got turned away last year. And the young people come in with CVs that are absolutely astonishing. And they have secondary degrees, masters or PhDs, which was not the norm until the last 10 years in colorectal. So they have to do research. There's no way around it. It's pretty hard to get into a program unless you have connections that you haven't done research in, at least in the United States. I don't think loving the field is gonna get you into it anymore. I think you have to have a definitive roadmap and be flexible, but stick with it. But I think you have to get a secondary degree and you have to do a lot of research. Now, do I think that that's the best course? I'm not sure. Well, academics is really important, and I will not dispute that at all. You have to be able to walk the walk, and you have to be able to do surgery. So I think that we're gonna, I hope, pivot away from the strictly academic part of it and really make sure we're not leaving the technical part of it behind, because I worry about that a little bit.
Yeah, I think, you know, same in the UK, you have to tick the boxes to get on it. I mean, in my day, there was the BTA, we called it, which is Been to America. Everyone had to go and do a higher degree in the States if they wanted to get a prime job in the UK. So, and I agree with you. I think I knew technically very talented young surgeons who couldn't get through that process, and it was a real shame that they couldn't. So, just sort of to finish off, Tracy, what have you enjoyed the most about your career up to date? What would you say has really been the most enjoyment you've got?
Okay, so I guess when I look back, so I've been at the clinic for 30 years. This is, besides my residency, really kind of the only place I've been. So I guess I have a little bit of a sheltered existence. When I look at the first half of my career, I was really surrounded by giants, technical, talented giants in the field. Now, I have to tell you, I thought that was normal and I really took that for granted. I'd like to go back and learn again from them with a little bit more appreciation. And not that I didn't appreciate them, but I didn't appreciate them to the extent that I wish I would have. And then I think in the second half, carrying on some of those traditions, I think that it's very satisfying to take a patient to the operating room who has some kind of disaster that happened from an operation and put them back together and give them their life back. I mean, nothing to me is more fulfilling than that. Cancer operations are fulfilling, don't get me wrong, but those patients have a completely different set of expectations. Some of these poor miserable people that have fistulas with, you know, towels catching the effluent, and their skin's terrible, and you can give them some quality of life back. To me, that is really, really fulfilling.
Putting Humpty Dumpty back together again, as it were.
Kind of like.
I completely concur with you there. That is a real special thing to be able to do. Tracy, you're an inspirational surgeon. You know, probably one of the best known surgeons around the globe, and you've trained many to be in your image, as it were. And I have to say, it's been a pleasure to get to know you a bit since I've joined the Cleveland Clinic. And also, thank you so much for spending the time to chat to us today. I wouldn't have thought that your upbringing involved veterinary medicine, and I can see how that may have influenced you. So no, it's been a real pleasure to talk to you. Thank you very much. Are there any last words you like to have, Tracy?
No, thank you very much for having me. When I look at I have to laugh, because when I look at the title, Inside the Expert's Mind, I always think to myself, wow, is that me? I guess I don't think of myself as like the expert or anything like that.
I think you're an inspirational expert, Tracy. Actually, I should have added that to the title. Thank you so much, and I look forward. Hopefully, we'll be allowed to come to the States, or you'll be allowed to come to London, and we can meet together in person soon. So thank you again. Thanks very much.
All right. Have a nice day. Thank you. Bye-bye.
Bye.